Hello, it's Anna Jyoti, School of Fine Tuning, and I'm going to talk you through the anatomical jargon that I teach when I teach anatomy and physiology. And I think it's great to have a really good understanding of the anatomical jargon, so that first of all, when you're describing or discussing your clients or patients or guests to other therapists, if you're doing referrals, but also if you're describing to your patients or clients, and also just for your own knowledge and understanding, I think it's really good to have your anatomical jargon good. So in the anatomical position, can we see that? Let me just point that down a little bit so that when I'm standing back you can see me. So in the anatomical position, which is palms face forward, yeah, that's okay. So palms face forward, this is the anatomical position. So everything is from this position. And so when we're doing the front of the body, this front of the body is the anterior, anterior, anterior. I do invite you to do these motions and say and repeat after me, anterior. And then the back of the body is posterior. So the back of the body, anything on the back of the body is posterior. So even in this position, this is posterior and this is anterior. So whatever position you're in, based around the anatomical position, this is anterior, this is posterior, anterior, posterior. Then we imagine a central line, the midline going right through the center, and one going this way and one going that way. So we have anything towards the midline is called medial. So anything towards the midline is medial. So when you're towards the midline, on the arm, this is medial, on the leg, this is medial. If you were talking about your eyebrows, the inner here, this is medial. And anything outer towards the outside is called lateral. So towards the outside of the body. So this is lateral and this is lateral. And on your brow, this would be lateral. And on the clavicle, this would be medial and that would be lateral. And on the scapula, you have medial and lateral. And on the foot, you have medial and lateral. So the inner is medial and the outer is lateral. And then we have superior, which is usually on top, superior on top or above, and inferior is below or under. So superior, inferior, anterior, posterior, medial and lateral. Then we have distal is furthest away. Distal is furthest away. Had to think about it for a moment. And then proximal is closest to. So when you're referring to something in relation, distal is furthest away and proximal is closer to. So we've got medial, lateral, superior, inferior, distal, proximal, anterior, posterior. Then we have superficial, and deep. And then we have terms of movement where from the midline, we're going to go abduction is away from the midline, abduction. And we have adduction, comes closer to the body. So we have abduction, adduction. Then we've got a rotation, which is when we talk about lateral rotation, the ball socket joint can do a lateral rotation. And the shoulder, we can also do a lateral rotation. This is a circumduction. Circumduction goes all the way round, circumduction. Then there's a sort of pivot joint, a pivot movement, which goes from side to side, pivot. So rotation is a rotating in the ball socket joint, and the pivot is a movement on one axis, if you like, from side to side. What else have we got? We've got inversion, where the sole of the foot goes in, and eversion goes out. We've got plantar flexion, where you point your toes, and dorsiflexion, where you point your toes up. We've got flexion. A flexion is anywhere where the angle goes smaller. So this is a flexion, as is that's a flexion. And an extension is where we extend the angle, extensions. So an extending the hip, extending the upper thoracic spine, and here we are flexing. So what else? I think that's it. I think that's it. Is there anything else? Pivot, rotation, elevation and depression. Elevate, depress. Medial, lateral, distal, proximal, superior, inferior, anterior, posterior, abduction, adduction, rotation, pivot. I think they're rotations. They're rotations or pivots. Flexion, extension. What else? I think that's it. So I might have missed out one that's really obvious. I don't think I have. These are the actions. There are planes as well. I won't go into the planes just now. But these are really, really good to know, like the medial border, the lateral border, the superior angle, the inferior angle, the medial end. So when you're talking about origins and insertions, you can see, the lateral edge, medial borders. You can really start to understand the attachments. So I hope that's helpful, and I thank you for watching. Oh, sunshine.